TB lymphadenitis presentations, gradual painless fluctuant, pus, lumps on neck cervical region with overlying skin intact changing to shiny, pink to red and warm, usually in children or young adult, no systemic symptoms investigation. Fine needle aspiration for AFBDS and biopsy for histopathology. Abscess may still form at lymph node after treatment equals treatment failure, due to inflammatory response to antigens released by dead bacilli in lymph node DDX for lymphadenopathy, metastatic LN, for example NPC, lymphoma. TB meningitis, presentations, fever, headache, drowsiness, focal neurological sign, convulsion, investigation, CT, LP for IPE and CSF, AFBDS, PCR, AFB culture, high protein and low glucose, lymphocytic pleocytosis, PM in an early stage, staging, I, conscious, non-specific symptoms. 2. Disturbed consciousness. 3. Stupor, coma, management, anti-TB, adjunctive steroid, surgery, VP shunt, lower IPE, excision and excision and debulking of tuberculoma, biopsy. Miliary TB, presentations, fever, lethargy, weight loss, cough, non-specific, hematogenous route, all organs potentially involved, investigations, CXR, tiny millet-like, 1-5 mm, shadowing on CXR, early morning urine for AFB, urinary involvement, biopsy and histology of involved organ, start empirical, do not wait until gear. Genital TB, female, presentations, pain, abnormal menstruation, pelvic mass, ascites, infertility, greatly mimic Ginny malignancy, with CA125, marker for ovarian cancer, also raised, investigation, endometrial aspirate for AFB culture, biopsy through laparoscopy. Genital TB, male, presentations, scrotal swelling, dysuria, pyuria, hematuria, hemospermia, infertility, investigation, early morning urine, semen for AFB culture and TB PCR, biopsy. TB in elderly, higher incidence, higher mortality, reasons for higher incidence and mortality, poor cell-mediated immunity, more comorbidities, more smoker. Presentations, more non-specific, CXR, less upper lobe but more extensive infiltration of both lungs, cryptic tuberculosis, hematogenous as military, acute insidious onset and non-specific symptoms usually attributed to tumors chronic disease, acute no miliary pattern on CXR, AFB sputum and TST usually vet, acute may shown on PET CT as miliary nodules. TB in very young, 5-0, rare, presentations, cough, fever, non-specific as usually extrapulmonary, TB in HIV patients, immunocompromised, presentations, fever, weight loss, cough, non-specific, plus extrapulmonary involvement, more disseminated and extensive, early stage HIV, CD4+, 200, presence as immunocompetent subject, pathology, no zonal predominance, no CAV. No zonal predominance, no cavitation, more extrapulmonary, TST vet. Relationship between TB and HIV infection, decreased immunity, due to HIV, lead to TB reactivation and progression, pro-inflammatory cytokine PFAR produced, due to TB, lead to increased HIV viremia. Treatment ADR is more common, for example, E. Retrobulbar neuritis in CRFA grade adjust, E. H. Dose and do not use aminoglycoside, drug interaction, R. Decreases efficacy of ephrabarens in NRTI, raltegravir, lapinavir pi A grade best to have. Higher mortality, treatment, 2-HRZE 7 hours, daily, not intermittent, prophylaxis, 9H7 or 9H2, immune reconstitution inflammatory syndrome, IRIS. After starting antiretroviral therapy, restoration of the immune system lead to exaggeration and worsening of opportunistic infection, TB leading to fever, cough, sob, enlarged lymph node, UDS, etc. Treatment, NSAID, prednisolone, or even stoppart. NTM lung disease, presentation, local in postmenopausal women, tall and slender male, patients with mitral valve prolapse, joint, laxity and chest wall deformity, for example scoliosis, disseminated in HIV patients, MAC, hot dud lung, presence as hypersensitivity pneumonitis in otherwise healthy individuals, diagnosis of NTM lung disease, respiratory symptoms and CXR high-resolution CT/HRCT nodules cavities and
2 sputum artı ve or 1 bal artı ve or.
biopsy showing mycobacterial histopathology. Response to treatment, M. cancer E, MAC, M. abscessus, treatment of NTM lung disease, drug susceptibility test, clarithromycin plus ethambutol plus rifampicin, 12 M.
Kansashi.
Mimic pulmonary TB, RX, HRE7X 12 meters. Disseminated MAC in HIV, RX, clarithromycin plus ethambutol plus rifabutin, lifelong, rifabutin with less interaction without prophylaxis, azithromycin. M. abscessus, chronic incurable nodular bronchiectatic disease, RX, aminoglycosides, macrolides, doxycycline, ciprofloxacin, surgery. M. fortuitum, lipoid pneumonia, alveolar proteinosis plus gastroesophageal disorder recurrent aspiration, RX, fluoroquinolone containing X 12 meters. Standard RX, 2 HRZE 4 hours, 2 months 4 drugs followed by 4 months 2 drugs. Isoniazid, H. INH or which make Fars IIA grave, mycolic acid CW. Hepatitis, cutaneous HS, peripheral neuropathy. Most important. Rifampicin, R. MNA transcription. Hepatitis, cutaneous HS, thrombocytopenia, UF. Most important. Pyrazinamide, Z. Fars 1A grave, mycolic acid. GI, hepatitis. Without Z, RX duration need to be extended.
Arabinosetransferase.
Arabinogalactin, CW. Ethambutol, E. Retrobulbar neuritis. Not used in patient who cannot report symptoms. Streptomycin, S, bind to 30s, MNA, T. Hearing loss, tinnitus, vertigo. Not popular due to buttercomb injection required. Adverse drug reactions of TB drugs, GI upset, Z, R, exclude hepatitis with blood test, sharp increase of all 3X, bilirubin 2X, normal, administered drug with food plus antiemetic plus nighttime plus capital X antacid, interfere H, R absorption, try intermittent regimens, not everyday, 3DW, fixed dose combination tablets, but not split doses, suboptimal drug level. Itching rash, H, R, itching without a rash, give antihistamine or topical steroid, rash life-threatening skin condition, systemic steroid plus withdraw drug and reintroduce later, starting with the drug least likely to be responsible capital XH, R. Stevens-Johnson syndrome, SJS, age-mediated HS that involves skin and mucous membrane, S 30% body surface areas laughing a grave mortality rate 25-50%, bacteremia, sepsis, acute drug reaction with eosinophilia and systemic symptoms, DRESS, S treated by, desensitization plus steroid cover, S presentation, generalized skin rash, consult dermatologist if necessary. Presentation, generalized skin rash. Consult dermatologist if necessary. Hepatotoxicity, HRZ, presentations, anorexia, nausea, vomiting, blood test, sharp increase of alt 3x, bilirubin more indicative 2x, normal, acute elevation in alt, bilirubin, hepatic cause, acute elevation in bilirubin, alt, cholestatic cause.